The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead.
Welcome to Project Independence and You.
Good morning and welcome to Project Independence and You, Community Talk Radio on 88.1 FM and WCWP.org. I'm Rebecca Miller along with Kristina Liu and Dan Cox. We're your team for today, and we're going to be talking to Danielle Ezzo, who is a associate clinical professor at St. John's College of Pharmacy and Allied Health Services. And Danielle has her doctorate in pharmacy. And we were talking before the program just to get some clarity and a little bit of a background on Danielle and, you know, the difference between pharmacy and pharmacology. And also, you've been a really great friend to Project Independence and You for many years. You've been a speaker at our Aging in Place conferences, along with many other programs that we've held. Medication management is so important to everybody, but especially seniors, because a lot of times we're on a lot of medications and medication changes and adjustments, and you know, it's confusion, and there's a lot of organization that you have to kind of get used to doing. But before we get to that, I wanted to thank you again, Danielle, for joining us today. And also, if you could give us a little bit of a background on you and St. John's and your degrees.
Yeah, thank you. Well, thank you for having me. I mean, I do always say, you know, when I tell my students from St. John's and my colleagues that I'm doing something with Project Independence, it's definitely one of my most favorite things to do as part of my role as a pharmacist and a faculty member at St. John's. So, you know, I know I was mentioning this before we went on. I'm a graduate of St. John's University. I actually graduated with both my bachelor's degree in pharmacy and my doctorate in pharmacy. The pharmacy program is a doctorate program at this point. So everybody graduating from St. John's, and most, you know, in all colleges of pharmacy at this point, it's a doctorate. And I know, you know, it's funny because when people talk about, you know, sometimes they don't say like, oh, you're a pharmacist. They say, oh, you're a pharmacologist. And those are actually two very different things, right? You know, we do a lot of pharmacology as training to be a pharmacist. And that is, you know, how drugs work in the body. How is it used? What effect does it have in the body? How does the mechanism of action? And those are all important parts of being a pharmacist. But the difference between a pharmacologist who's, you know, more doing like bench research on how those drugs are working, finding new molecules, you know, to new agents to treat diseases. You know, a pharmacist is someone that's really applying all the information to what patients go through, right? So you also mentioned about, you know, patients, you know, feeling confused about their medications, or if they're feeling one of those side effects, what do they do to help management? How can we change the drugs? So a pharmacist is, you know, obviously we know that it's the person working with the patients, but they're really the people more patient facing, where pharmacologists are typically more, you know, doing that bench research, which is so important to getting those drugs to market. You know, so as part of my role as an associate clinical professor at St. John's, you know, my profession is pharmacist, but I'm also, like, my practice site, you know, where I practice pharmacy is in a doctor's office. It's the best way for me to explain, you know, what I do. So I'm a pharmacist in a doctor's office. It's actually affiliated with a Northwell primary care adult medicine, where I see a lot of seniors, but we also see, you know, adults from 18 and over. And I work with the medical team, and the medical team includes medical residents, physicians, a nurse practitioner, nurses, a nutritionist. It's a really interprofessional team, right? Like that's the, you know, a big word in medicine. You want a team where you see more than just one healthcare professional, because everybody brings something to the table. And that's nice. You know, that's what's nice about St. John's University. You know, the College of Pharmacies, their official name is College of Pharmacy and Health Sciences at this point, because we have many other healthcare professions within the college. And, you know, the students learn together or work together so that we can put out professionals that are used to doing that, you know, in practice, so we can really deliver the best care for patients.
Excuse me. Right. I mean, it's so, it's nice to have a kind of like a multi-specialty kind of place too. Is that kind of where you're at? Is it
Yeah.
multi-specialty or is it,
Well,
yeah,
yeah,
because
it's both.
especially for seniors, to
It's
have to like refer someone to a different doctor to get all the
right.
records transferred, maybe they're not in the same system, that kind of a setup makes so much more sense today.
Yeah. Yeah, the practice that I'm at it's actually both of what you're describing. It's multi-specialty, which means we have primary care, but we also have an endocrinology practice that meets there, a rheumatology practice, a gastroenterology, the people that work with, people's stomachs. But within those teams, you have multi professionals that are working together, and it is unique. And I feel really lucky to be in a space like this. And for my learners, my pharmacy students, and my pharmacy residents that are doing postgraduate training, they are just immersed in such a place where they're learning not just from me as a pharmacist, but they're learning from the physicians, they're learning from the nurses, they're learning from the nutritionist
Mhm.
and clinical diabetes educator, certified diabetes educator that we work with. So it's a really great place to learn, and the patients just get this care that's just so wonderful. There's still challenges, but we're learning and we're really almost producing a better plan for patients. Um,
Right. I mean,
so it's a little bit of both.
the continuity of not just the healthcare, but also like the medication, the pharmacy, having
Mhm.
different pharmacies and
Yep.
different, that's a disaster too. One of the things I was just thinking of when you were talking is like, because of course, so many young people in school and today with access to the internet and all the information, I'm sure it's caused a lot of problems for pharmacists, also doctors, because, I'm sure you hear from a lot of patients, well, you know what, I researched on, Google and
Yep.
these are the side effects and I shouldn't be, it's like there's so much information. And when like I have even friends that are taking something, and you read all the side effects, I'll always say, just call the
Yeah.
pharmacist.
No,
You don't really
you're,
apply to that. You may not
yep.
apply to it.
You're so right. One of the first things I ask people when they say, so I heard that, and
Right.
then they tell me that, and I say, well, where did you hear that from? Just to understand where the source is. And you're right. Most of the time, it's the internet, or it was a friend, a family member, right, somewhere other than a healthcare professional, because it's my way of answering too, and where the information comes from kind of makes a difference, right? So that's always my first question when patients say, well, I heard this is good to take. Like, well, where did you hear that from?
Right.
Was it an ad on TV, right? Because that makes a difference. And you're right. A pharmacist, even if look, I'm in a unique place, but the pharmacists in the community are such a resource for patients.
Hmm.
If patients are filling their medication, with any, particular pharmacy, that pharmacy is such a wealth of information. And chances are their medications are being prescribed from, you know, prescribers that may not be talking directly to each other. And the
Right.
pharmacist really is that, one person. If you're filling all your medications in one spot, the pharmacist is the person that can really tell you, how those drugs are interacting, if the doses are correct, if you're experiencing something that maybe you don't know is an actual side effect. Pharmacists can tell you if it's potentially your medication, and even communicate on your behalf to that practitioner, to that prescriber that's prescribing the drug. Because sometimes the conversation is a little bit complicated, and the
Mhm.
patient can't translate that to a physician. And pharmacists do that on a daily basis. Sometimes, it's funny, when I was working in the community, because I have a strong background in working in the community for a long time. Patients would be so thankful when I called their prescriber about a question that, commonly we had about a medication. They're like, wow, we didn't know that pharmacists did that. And it's like, of course we do. We
Right.
want to keep patients safe. And we kind of live in this world right now where it's almost no longer possible for patients to fill at one pharmacy, just because of what the insurance companies sort of require. Most patients are saying, well, I have to fill this through mail order so that I can get a better price, right? Cost is a big part of medications.
Sure.
But then there's also this stuff that you need a little bit more quickly, right? If you have an infection and you need an antibiotic, I really always encourage patients to keep one list of medications on them so that if they do have two pharmacies, maybe more in some cases, that they can share with, both parties, right? Both pharmacists, these are the things I'm taking you may not have in your system.
So if like I use CVS, say, and I have, or, my mother certainly does mail order.
Right.
But she doesn't go through a CVS, but it's important for that pharmacist to know. So is there like a form usually, or how do you just call and say, hey, listen, I use you, but for this particular medication, how do you inform the pharmacy that you're not using them for mail order reasons, and how do you get that into your, profile?
Yeah. So, usually so let's take the example if you're, there's no more dropping off prescriptions either. That's
right.
The other thing, right? Because everything is electronic. Telling the pharmacist, I am on other medications that you might not have in your system. I think that's like a proactive thing that patients, if you're using two pharmacies, that's an important thing for patients to proactively tell. They should be asking also, are you on other medications? But, that may or may not happen depending on who picks up the phone, when you are picking something up at the pharmacy. So it's important that if you're on, medications that you're not getting at that particular pharmacy, to let them know. And usually, not usually, but they will document in their system, in a way, and it's going to be different, right? For every pharmacy, and depending on what computer system they're using. But they will put that into their system, and a pharmacist will check based off of a list, even if they're not, the ones dispensing the medication. So, that's important, right? You kind of alluded to, is there a form? Not that I know of, right? When I think where I thought you were going with that is like, is there a form to keep a list of medications? And there's so many different types.
Oh yeah. We have that for our, we have little cards, we have, all kinds of things.
It really takes a proactive role of a patient, right? I like to describe the team, a patient's healthcare as a team, right? When we say team, we always think of, all the healthcare professionals, but the patient is part of that team. In fact, I think the patient is the captain of that team, right? And it's the patient that, does need to, share what's going on. And some people are really good at that. Some people, just maybe assume that everybody knows about them if they're looking in a medical chart. And a lot of times they do know a lot about them, but we want to hear what the patient knows about themselves. There's a lot of talk about patient self-advocacy, because patients have to go home and care for themselves. And some people have, a couple of one disease state, maybe they have high blood pressure and they're only on one med, maybe two meds. Some people have high blood pressure, diabetes, high cholesterol, and they might be on 7 or 8 medications. And it can get confusing and it can get costly. And at the end of the day, those patients still have to manage all that, right? We sort of titled this as med management. What does med management really mean? It means, how are you taking your meds throughout the day? That's one part of med management.
Right.
And some of med management is on the ownership of the patient, because the team can't be in the house with the patient. Sometimes there's home care, sometimes that can be arranged, but for the most part, people are living independently, which is what we want. So we have to give patients the skills they need, to manage their daily medications. And there's going to be questions and there's going to be assumptions, right? So a lot of times, when I meet patients in any setting, whether it's, at the office that I describe, like you said, I do a lot of work with Project Independence and some of the senior centers that are around, I tell them, tell me your medication story. What do you do from the morning when you wake up until you go to sleep in regards to your medication? And it helps me get a sense of, is this right? Can the patient keep doing it this way? Or do we need to make some tweaks? Or do we need to make some big changes?
Right.
So I'm always going to want to hear that story.
I know like even a thyroid medication, some medications you have to take on an empty stomach, some you have to take with food, some you need to take before bed, some you take 2 times a day, sometimes it's multiple times a day, and some people may get tired from their blood pressure medication. Do they take it at night? So everybody has their own story. Medication management, of course, just like all the topics we talk about on this radio show and all of our programs, the education piece is so important. And what I like about a lot of the medication management programs is people come in with their bag, right? They come in with their medication and they get to speak to a pharmacist or a doctor, and it's really their own personal story. Because if you come in with a friend, even if you're both on 5 milligrams of Crestor, one of you is taking something else, and your story is different, your physiology is different, right?
Exactly. That's the message I really try to get across to patients. Like you see, traditionally we called those meetings brown bags, right?
Yes,
the idea of everyone bringing in all your medications in a brown bag, and a pharmacist going through those, asking you your story, putting your individual story together. And you're right, just because you're on the same exact medication as somebody else doesn't mean it's going to work in your body the same way. Right. And that's the problem, going back to your thought of where are patients getting their information from? What works for one is not going to work for everybody, and vice versa. Right. Because we meet patients that are like, oh no, my friend was on that and she had a bad reaction to it. Right. So sometimes patients don't want to take something because they are fearful because somebody else that they know in their lives took it and had a bad side effect. I try to explain to patients, as your medical team, we are trying to figure out if this drug works for you. I don't know what happened with your friends, but I can really only speak for how it's going to work, how I think it's going to work in your body.
Right. And that is so important. It's like your own story. This is great information. We're actually going to take a quick break, Danielle, and we're going to be right back with Project Independence in You Community Talk Radio on 88.1 FM and WCWP.org. We'll be right back.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
And welcome back to Project Independence in You Community Talk Radio on 88.1 FM and WCWP.org. I'm Rebecca Miller, and of course, along now with Kristina Lou. We had a little technical difficulty.
Oh, I know, my gosh. I was frantically trying to connect with you guys. I'm glad I'm here.
I know. I was ready to start filming some kind of horror movie. What's happening here? Where's Kristina? What have you done with her? But because you would pop up and there'd be 4 of you, and then I'd hear an echo, but you weren't talking. So I'm just glad that we kind of worked it out, and we can.
I'm here. Fingers crossed.
Continue with this lovely conversation with Danielle Ezzo, who's just giving us a whole host of really great information. One of the things I can't help but think about, we're talking a lot about Google, Dr. Google, Professor Google. But some of the things too are there's all these great medications that are out now for so much advancements. You hear them on commercials and you hear what it does, and everybody has a beautiful story how it's their life's been maybe longer, better, healthier, fitter, all these things. And then it gets to my favorite part, which is kind of almost like a scary movie, are the side effects.
Yeah.
You could have it could actually enhance the disease, trigger the disease, and other little things. So how do you kind of, I don't know, let that minutia kind of give you confidence to even try the medication? I mean, that they have to say it too. I'm sure that it has to do with disclosure, and things like that.
Right. That's when you hear the commercials on TV, they have to give that disclaimer, right? They just, by law, if they want to put the commercial on TV, they have to say it. I remember, my grandmother, she's passed away now, but a while ago, and not because of this reason, but she started a new medication when she first got high blood pressure. And it was metoprolol, which is a medication that, is fairly well known, has been used forever. But she opened the package insert. She read that fine print, every single one of them. And when I got there, I remember the whole package insert was on a magnet on her refrigerator. And she goes, "Look at this, Danielle. It causes death. Like, I'm going to die. Like, do you want me to die?" It's like, no, grandma, like, I absolutely don't want that to happen at all. And, right. Like, people are going to see those scary things and be like, I don't want to take it. I feel actually pretty good, right? Most people that have high blood pressure, high cholesterol, they feel pretty good. And then they take a medication and they start experiencing these side effects. What I try to, at that point, because it's true. Yes, these things in clinical studies, someone experienced it, whether it's because of the drug or because of something else, sometimes that needs some, further looking into. But I try to explain to people the risk versus benefits, right? The risk that this drug puts you at needs to be lower than the benefit. If the benefit is outweighing the risk, then it's an important medication for you to take, right? Some people think with high blood pressure and high cholesterol, nothing's going to happen, but that's not always the case, right? The case is sometimes those things need to be treated, especially if it's high. That poses a significant risk to people. And the drugs, although it may take some time to balance out, we need to balance those risk versus benefits. I also explain to people that through blood work, we could see a lot of how, the body's working, right? We look at people's kidneys and their liver and their heart, other organs, depending on the drug. We look at them, what we call baseline. How is your body working before we start the medications? And then we monitor throughout treatment, right? So that's why things like follow-ups with the prescribers, getting your blood work on time are so important, because if we see a small creep up in something like kidney function, or depending on how you're talking about it, a bump up or a, slow down, we're going to say, okay, wait, could this be because of the new medication? And that's a lot of the reason why it's so important to have a pharmacist on your team, whether that be, all together under one roof or, out a pharmacist in the community, because we are going to be one of the people that reminds the team of like, hey, we have to look at how this person's body is functioning. You've been on this drug for 3 months now. Let's see if it's hurting the body, but also let's make sure it's helping the body. Right? We want to make sure that we're hitting goals. So we're not monitoring just for the scary part, right? When I train pharmacy students or any learners for that matter, I like to talk about the good, the bad, the ugly, right? And telling patients, let's talk about what good this drug can do for you first. Then we'll talk about the bad, which are the common side effects, like maybe a headache and upset stomach. And then the ugly are some of the scarier things that usually are much more rare. And if that good way outweighs that ugly, then it's a drug that we should be using for a patient.
I mean, and the other thing you had touched on it, and it's so important, is being compliant. As a patient, getting your blood work and showing up to the appointments. There's a reason. I think sometimes people feel like, oh, the doctor just wants to bill me. Well, you know what? It is a business. It is their job, but
absolutely.
It's good to know that you have a doctor who, is looking to make sure that you get those the consistent blood work to make sure the medication's working right. Because you could take it and, maybe it has no effect on you, and then you're, at all. Yep. And, you just got to really be your own advocate, and it's hard, especially when you get older, because Danielle, it's so confusing, a senior who's, on their own and goes to a doctor, even not a senior, but maybe you happen to be on a lot of medication, and the doctor says, okay, we're going to let's just increase the blood pressure medication. Everything else will stay the same, though. I want you to see this doctor for that rash on your heel. I want you, blah, 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 blah. And, the person's still on, wait, you're raising my blood pressure medication? Or how is my blood? They're worried about that. So it's so, complicated. Today, though, what I like is most doctors will give you a report of the visit, like in real time, because everything is in there, putting it all in, and then you get a nice printout. Okay, you might be killing a few trees because you'll get a lot of pages because you might get the last few visits, but you can always ask for a report of your visit, or they may not have it in that moment, but you can have it mailed to you. And for the most part, you're going to get the details of the visit, and and might help you to revisit those notes.
Yeah, and a lot of systems are going to electronic charts. I mean, at this point, I think the majority of everyone is using electronic charting, but they have something called a health portal, right? So it's not only your access to your medications, right? So that's also a very as a pharmacist, that's the feature that I would be most interested in. But also you have access, it's called open charts. You have access to the note that the practitioner writes about your visit. You have access to your lab work, which is, again, good and bad, right? I have a lot of family members that will, they'll get their lab work and they'll be like, Danielle, what does this mean? Am I okay?
Why is this?
Right. Why is this in red? Because you see, the green to the red, or, the good range. And, we do a lot of, explaining what it means, but it's important. So I would say if patients have access to that, it is good access, but you do need to partner that with having the conversations, with the people that are your healthcare professionals, and not making assumptions, and trying not to, just go to Google to see what it means.
Right.
Sometimes you could be just outside of normal, but it is really normal. Sometimes those values are set in a way, that are meant to be closer or further apart to trigger, an alert to go off.
Right. Like if your sodium's low or high, I mean, not, but in the normal range of
exactly.
And it could be the time of day. It could be, that kind of a thing. So, if your doctor basically has signed off on your lab work and they told you verbally, very happy with your lab, everything looks normal, and then you look at it and say, oh, mate, something might be a little bit elevated. He's telling you it's okay, or she's telling you it's okay, So, but of course you have to look and say, well, why is that elevated? What does that even mean?
Well, it's everyone, I'm laughing because, my mom's going through medical stuff. So there's constantly these health portals. So me and her, we made a pact to just not try and pretend to be doctors and interpret, because when she was getting these reports, I was sitting there and I'm running my own reports. If I know what any of these words even mean, I couldn't even say half of them, but we're a family of anxious people, clearly. And my husband got his report, and he spoke to the doctor, and the doctor was like, everything is good. This was his physical, and he gets it in the mail, and he's like, well, I don't understand this level. I was like, you just had a conversation with your doctor. Right. So you don't even know what this number means. Well, it looks like it might not be, it might be high. I'm like, so I think that it's so great that we get all this information, really fast and in real time. But I also just, want people to be there, just it's so important to have the conversation with your doctor and let them, interpret it. And for us not to play, doctor on the other side.
Yeah. And, especially when it comes to medications, with that example, Kristina, too, sometimes when patients start new medications, or they hear something on TV, or they hear a friend, they're honed in on something too, right? They might be like, oh, let me double check. I'm going to look at my labs. Let me look at how my kidneys are working, if they even know where to look for that. And they get panicky. And I think that's a natural reaction, right? So also, your physician, of course, have those discussions too. But if, pharmacists know a lot, and if you're under the care of a pharmacist, sharing little pieces of those informations with them too, they can at least help settle some of that panic, right? One of the things that, again, when we train pharmacy students and pharmacy learners, we might not be under the same roof as the prescriber, right? Whether that's a physician assistant, a nurse practitioner. But one of the things that we ask when it comes to medications is, what did the doctor tell you this medication is for? right? Because we want to be speaking the same language as best we can.
I like that.
We want to make sure that, drugs can be used for different things, right? I mentioned the drug metoprolol before. We used to always think as a blood pressure medication, and it's really not. It's a medication for your heart. It slows down the heart a little bit, to make a stronger pump for the heart. So if I tell a patient that, like, oh, this is a drug to lower your blood pressure, and the patient's like, well, wait a second, my doctor said it's for my heart to make it pump harder, that's going to be confusing. So I want to know what the patient already knows. It kind of goes back to that self-advocacy. And it's a way for the pharmacist and the practitioner to be a little bit in line, right? The next, we call these the 3 prime questions. What did your doctor tell you this medication was before? How did your doctor tell you to take it? Right? Because that also helps us double check if the prescription that we have that we're dispensing is correct. It helps us double check if the patient understands something. Maybe, some people hear something once and think they heard, oh, I take it once a day. And it's actually a twice a day drug. So it helps us already know the level of understanding of the patient. And then the last question is, well, what do you expect from this medication, right? And this is where that good, bad, and ugly come in, because most patients are going to say, well, if it's something for, their blood pressure, I expect my blood pressure to go down. And, I always tell learners, like, you need to say, well, that's right. Yes, we expect your blood pressure to go down also, but these are the other things that you need to look out for, or you need to understand if this happens. It could be related to the medication. So I think that part also, Rebecca, you had mentioned that education part. That part is also important to hear, because then if someone has told you this might happen, when it does happen, you're not as panicked. Right. You're not as panicked that it happens. I'm not saying that you're like, no worries. Like, I knew this was going to happen, but at least where's this coming from? Oh my gosh, how much worse is this going to be? The patient is aware, and then, maybe can take some actions. Maybe they call their physician and say, this did happen to me. The pharmacist told me it might happen. I want to let you know it's happening. And then, the medical team can kind of take over there with some instructions of, okay, let's give it a few days. Your body's going to get used to it. Maybe it's not the right drug, right? But, it's just a way to help the pharmacist and the patient and the practitioner to sort of all be on the same page and communicate.
Yeah. Danielle, you brought up an interesting point, and I was just thinking this. I can't remember, Kristina, a few radio shows ago, we were talking about with Otto too, like, expectations of realistic expectations on the patient's part. Like, someone who goes in, has a knee replacement, the knee is working so much better. Like, they have the mobility's back, but they're still in pain. And they tell the doctor, I'm like, well, you're always going to have pain. Well, they didn't realize that, because the doctor that did the surgery, their point is to get that mobility back, that person up and walking in a healthy way. Maybe didn't say, you're going to still have some level of pain, So like with all kinds of medications, when you go in, you say, okay, maybe even if it, like, your first time you're going on a medication, especially, it takes about 3 months before we see a little bit of a change, so don't, and a lot of times, especially with cholesterol medicine, you don't feel it, you don't feel it. It's like you have to wait for the blood work. So it's, with blood pressure medicine, you might feel a little different. You could feel the tiredness or whatever, and that kind of a thing. So I like what you were saying, for doctors and pharmacists to let the patient know, because the patient doesn't even know to ask that question. Like, what are the expectations of this medication? And is there a way that I will notice a change? And if not, it's only going to be through lab work, something like that. So, and had, that person who had the knee surgery maybe knew that there was going to still be pain after. Maybe they would have made a different decision, or maybe not. Maybe just knowing that they're going to have their full mobility life back, and they'll have to live with a little bit of pain, or at least in the near future. But they didn't know that. So they weren't doing well,
we had I think we were talking about heart health, or we had a cardiologist on not that long ago, and we're talking about, blood pressure medication. And there's so many people that think, okay, great, I could just take this pill and my blood pressure is fine. I could eat what I want. I could,
Right.
because I say to my mom, I mean, my mom, is on blood pressure medications, and she, her blood pressure still runs super high, with these medications, and I remember it was one of my relatives who was saying like, oh no, like, I'm on blood pressure medications, like I can eat. It's like,
I can eat that
so
stick of
it's
butter.
so important to really have these kind of conversations, as you said,
Yeah.
and these expectations.
Right. We'll have to bring that back up, but we have to take a quick break. You're listening to Project Independence in You, Community Talk Radio at 88.1 FM and WCWP.org. We'll be back in just a moment.
WCWP is your home for great music and great conversation. You'll find all that and more on WCWP.org. Listen live on the web, check out the lineup, subscribe to podcasts, and stay up to date on the latest station events. Get in touch with us and let us know if you like what you're hearing. And find out how you can support or get involved at the only community public radio station serving Nassau's North Shore. Plus, sign up to get a free bumper sticker. It's all online at WCWP.org.
And welcome back to Project Independence in You, Community Talk Radio on 88.1 FM and WCWP.org. I'm Rebecca Miller, of course, along with Kristina Liu and Dan Cox. I didn't even mention that Otto isn't on today because he's golfing. It's actually
the nerve of him.
Tuesday. We had to pre-record the show. So you're listening, if you're listening to it, I guess, sort of live. It's September 15th show. But Otto, hope you're having fun. We're having a lot of fun and getting a lot of information from Danielle. We're talking about medication management and a lot of other things. But Kristina, you brought up such an important point. Like people who take medication, just because you're taking the medication doesn't absolve you of also eating healthy, exercising. It doesn't mean the medication is doing all the work. It's part of the plan, and that's also something that needs to be explained. Doctors are busy. We know that. We know times are different. Their time is very limited, but that is important, for someone to know. Just because I'm giving you this medication doesn't mean
it's not like a magical pill.
You still sit on the couch and not get yourself moving or whatever you have to do with that.
And then you have the flip side of that too. You have some patients that understand, like they're in a position, maybe their blood pressure is high and they do have to start a medication, but they also commit to lifestyle changes.
Right.
So a lot of patients, the other question, another very popular question they ask is, do I have to be on this drug forever? Yeah. That's a tough question, because sometimes even with big lifestyle changes, sometimes it's yes, but sometimes it's no. So another like big role that I find myself in as a pharmacist is looking at, when can a drug be what we call deprescribed? When can you come off of a medication? Or when can we lower the dose of a medication, right? So if someone does do, the lifestyle changes that are associated with a disease state, they start being more active, they do take their medications, they are losing weight, they're avoiding salt, their bodies, they're going to be playing a natural role in, correcting some of their disease state. But then what happens, is now they start having more of those side effects because maybe that dose is now too high of that drug. Right. So then, it needs to come down, right? The drug needs to be started to deprescribed. Maybe it's not coming all the way off of it, but coming down to the lowest possible dose, maybe until those lifestyle changes result in more, physical changes for them. So that's really important too, to understand, like, if you are doing things to correct your disease states, then your medical team, your practitioners are going to start recommending to come down on those medications. I'm not promising that, right? So it's a very tricky thing, because, like patients that, get diagnosed with diabetes. Will I always have to be on something? Sometimes the answer is yes, but maybe it's not 4 things to treat your diabetes. Maybe it's only 1 or 2 things. There are medications that are I mentioned before, used for dual purposes. There's a lot of medications for diabetes that, yes, lower the blood sugar, but also provide cardiac protection. So even though a patient's blood sugar may come within a normal range, the bigger benefit, the bigger good of that drug is that cardiac protection. So sometimes the choice is to leave somebody on the drug as long as it's not causing them to feel, their blood sugar to go too low. We don't want anybody passing out or any of that stuff. But that's the other part that sometimes patients can't understand. Like, even when they do all the right things, why do I still have to stay on this medication?
Right.
And that's when we get into let's look at the bigger benefit. There's levels of benefits too, right? And especially when we're talking about medications for diabetes, a few medications are tied to protecting the heart in addition to lowering the blood sugar.
Right. I'm kind of an example, a little bit of what you were talking about. A few years ago, my LDL is elevated. I have a great ratio. I mean, like a ridiculously 2 point, usually it's in the low twos is my cholesterol, but my LDL is elevated. I mean, and it's just, I don't want to say, I'm an athlete. I generally eat right. I do yoga. I do all the things, but it's genetic. It's something that I can't control because, like you were saying, I'm doing the right things. I'm living a healthy lifestyle. At least physically, I'm doing all the things. I'm eating right. Aside from like chocolate freakouts later in the day, Kristina could tell you a little bit about that.
Okay, but she's my supplier. I give her one piece every day.
Okay, she's my supplier. But
she's my supplier.
So that is frustrating to me.
Yeah.
But I do I take the medicine. I take Crestor. And it's what I do. So it's not just there's the other end of the spectrum too. The people that for whatever reason my cholesterol's up. It's not because of an unhealthy lifestyle. But I got to take it.
And what I would say, there's two ways that like I could educate somebody on that, right? So as a pharmacist, I could say Crestor is used. You're taking this to lower your cholesterol, right? And you understand what it's for. But I could also say you're taking Crestor to lower your cholesterol and reduce your risk of a heart attack and stroke. Mm-hmm. That's more impactful. That makes a patient say, "Wow."
God, I hope I took mine today. No.
Right. So it makes it more.
She's in a full panic.
1 second. CVS, I need to delete.
So it makes somebody understand, okay, well, like now I understand what the importance is of lowering my cholesterol. Specifically, you mentioned your LDL, which is, we talk about it being that bad cholesterol.
Right.
And that's important. It's hard to explain to a learner that's early in their years how different those two statements are. Right. Mm-hmm. But we could see it in your face right away, even just hearing that, like, okay, yeah, I want to do that. I want to reduce all the risk of those things.
I've had a lot of testing done prior. I've disclosed, I had a cardiac ablation out of nowhere. 2018, I had it done once. I know a lot of people have had to have it repeated. Yeah. Everything was fine after that. I've have no calcification. I had, the CTV or whatever that test was of the heart where I drank it. Everything is fine. But yet I still have this LDL that's high. Now I have an interesting thing that even my doctor said he very rarely has he seen. My HDL is higher than my LDL. Wow. And now they talk about the rate, don't focus much on the ratio because they're not really sure if that is, that's recently,
Right.
But my doctor believes that it's still good because the HDL, apparently there's scrubbers.
Yes.
That, scrub away
that's the good cholesterol.
Right. And that's how it works. But
having a very high HDL is protective, but there are no drugs that can do that. So that is an attribute to your healthy lifestyle that you described, right?
And it's a factor. And it's my own story. It's like someone else who has a high LDL, could have a totally different story. So my doctor is probably more comfortable with me staying on a lower dose of a Crestor because my HDL is higher. Like there's so many different things to the story.
Right.
Yeah, it's so important. This medication management, we were talking a little bit about it
that's
before.
why it's called management,
the brown bag.
Yeah, and I was just sitting here thinking, I mean, because you literally have to manage it. It's not something that's like a one and done, like here you go, you're on your way. Because I know so many people that I was like, even my grandparents, we'd go over things. I'm like, Grandpa, like, why are you still on this medicine? He's like, oh, I don't know. I've just been like on it for like ever, and it's like, well, like that's not like maybe you don't need it, as we were saying earlier. So I think it really is a constant managing. And as you said, Danielle, it's like really just getting all parties kind of involved in the conversation so everyone's on the same page. So I think that's just, the main goal of this is like realizing, you got to manage it. It's just one of those things.
Every patient, especially older adults, should have at minimum once a year, ideally a pharmacist, go through their medications. I'm trying to think when, maybe 2011, they came out with this program called Medication Therapy Management, right? MTM. And, when I learned about it, I was like, but this is what pharmacists have always been doing. We manage patients, medication therapy. But I'm mentioning this because this is now a service that, especially through a Part D plan, patients have access to this, whether it's done by a nurse, whether it's done by a pharmacist. It's usually a nurse or a pharmacist that's doing it, but it's really for that reason, Kristina, to go through a patient's med and ask those questions. Why are you still taking this medication? Why? So it's a little bit different than, your average, like talking about medications, but the purpose is to really make sure that there is still a purpose of that medication. There's a group of meds called PPIs, proton pump inhibitors. They're for the stomach, things like Prilosec and Protonix. A lot of times patients are on that for way too long. And most people are like, it's not hurting me. Like, I know I need it for my stomach, but it does have long-term side effects. Like that's a big drug that I look for when I'm reviewing patients' medications to see if patients can come off of it. A couple of reasons. Of course, we want to make sure that it's clinically appropriate. It's still providing the good. It's still needed. We don't want people on things that are not needed because in some way, shape, or form, there are after effects, right? There are side effects of it, whether that's long-term or short-term. But also, we want to make sure that it's also a cost perspective, right? Something that's unnecessary still has to be purchased, still has to be, accessed. And somebody that maybe it's covered for them, maybe they're paying $0 for it because, it's a generic and there's no copay. They might be less aware that they may not need that medication. It's usually the patients that have to pay more for it that are like, wait, do I really need this? Like, do I really, really need it? Because they do have to pay out of pocket for it. But one thing about those MTM sessions, it's usually not done with the pharmacist that you're familiar with. And what I mean by that is that it could be, you could fill your prescriptions at a Walgreens, but it could be a CVS pharmacist. Actually, it will probably be the other way around. You could fill your medications at CVS. It might be a Walgreens pharmacist that calls you up and says, I'd like to schedule a medication therapy management session with you. And patients may understand that, they may not. And that's really coming more from the insurance side of it because they want to make sure that you're on the things that you actually need to be on. And if you're not comfortable, if you get one of those phone calls and you're not comfortable, I would encourage a patient to, well, then get the information and you call them back, right? Because, there has to be a lot of, we have to be aware that, there's lots of crazy phone calls that kind of come through. So get the information or call the number on the back of your pharmacy card and ask about medication therapy management. Or if you're more comfortable, talk to the pharmacist where you're filling your medications. They'll be able to, guide you at least a little bit in where to get a session like that.
Yeah.
Good. Yeah, that's
You know, I just want to mention, because I know we're going to be running out of time soon, that Danielle will be, you know, she's always wonderful with our programs, and we're going to be open enrollment. We'll be kicking off in October. I think it's October 7th. Is that what it is? October 7th, usually the open enrollment period.
Yes.
So she's going to be doing a bunch of these open enrollment Part D, and they're individual sessions. It's going to be October 24th at the Great Neck Social Center from 10 a.m. to 2 p.m. And that were they usually about 20 minutes, right? Each like kind of
Yeah, you about 20 minutes,
block.
sometimes a little less, depends how many meds, sometimes
Right, of
more.
course. And then October 30th will be via the phone, because that was super successful when we actually started that during COVID, and it worked out pretty well. And November 9th at the Port Washington Adult Activity Center between 10 a.m. and 2 p.m. as well. So we will be obviously promoting that each week as we get closer, because it's such a huge service. You know, I'm always so blown away by this program, because Kelly, one of our nurses, at the end will always give me a total amount of the amount of money that was saved. And it's thousands upon thousands of dollars, you know, so it's incredible. It really is. And I thank you so much, Danielle, for
Thank
coming
you.
and doing that with all the students. It's just great.
You know,
I
that
actually, oh, go ahead.
Go ahead, Rebecca.
I was going to say, I actually have a question. I think Kristina and I are on the same boat when it comes to expiration dates. Like, you know, if it's that day, it's going in the garbage. You know, a lot of times when you get a prescription filled, it's 1 year from that day.
Right.
But, you know, they could have opened a fresh bottle that might go 2 to 3 years longer, but we don't know, you know, like number one, is that wasteful? Is it, I mean, how do you gauge those things? Because I'm a, you know, if it expires, I want nothing to do with it. I mean, and we've had guests on the phone that said, you know, when it comes to food, if it smells okay, if it's, you know, it's probably okay. It's kind of more of a recommended type of thing when it comes to food. But drugs are very different. You know, potencies could be lost, that kind of a thing. So what's your whole kind of, I want to say, you know, thoughts on expiration? Medication.
Yeah, it's definitely a conversation around that, right? Because you know, some people, exactly what you said, you know, they say, well, you know, that pharmacist could have opened a bottle that was good for, you know, 2 years longer than this is. We cannot guarantee the potency of that medication once it leaves that manufactured sealed bottle, right? So we have to, there has to be an assumption that you are losing some potency over the course of that medication going into an amber vial, and that being opening and closed, you know, maybe it's
daily, perhaps, right?
You know, so it brings up storage of the medication, right? You know, nobody should be storing their medications in, you know, traditionally what's known as a medicine cabinet in their bathroom, right? Bathroom is not a great place for storage of medication. It should be in a cool, dry place away from, you know, extreme sunlight, heat, you know, changes in temperature, sort of thing. So that's the thing, right? You know, if it's, we can't guarantee it. So even if that pharmacist opened up a brand new bottle and that's what you got, can't guarantee that past 1 year. My question usually before that is, well, why do you have medication hanging around in your house? You know, what, like, because if you're not taking the medication and it was prescribed for something that you should be taking it for, like, how is that winding up in your hand for a really long period of time? Now, if it's an antibiotic, you know, there's a conversation of like, you really should be finishing your antibiotic.
Right.
And, you know, one infection is not like another infection. So just because, you know, there's a lot of overuse of antibiotics and a lot of people do that. They don't finish their meds and they have a couple of pills hanging around. And the next time they sneeze or cough, they're like, oh, well, let me take that antibiotic. And that's could be a viral, you know, it could be something viral that has nothing to do with, you know, has nothing to do with the symptom that they're happening right now. You know, so usually with expiration dates, you know, if it's something severe, especially like asthma medication, I usually say get fresh, because the worst thing that can happen is not even getting sick, is that it not working when you need it to work.
Right. Not the potency is lost or something. That's a great explanation why. You know what? And there you go. That's why I get rid of it. You know, if it's expired, it's gone.
And there are places, you know, the police departments usually have a place to drop them. Some of the pharmacies now have a place to safely drop them, because that's always the follow-up question with expired drugs. How do I get rid of them? Which is more and more accessible.
thank you so much for joining us today. I knew it would go fast. I knew we'd have a million more questions. We'll have you back.
Best hour of my day, probably my week.
Oh, good, Danielle.
Thank you.
We feel the same. So again, thank you so much, Danielle, for joining us today. Great information, excellent educational information, really. And we look forward to having you back.